This conference will now be recorded.
Hi, everybody. I'm Jeannemarie Beiseigel, the Department Chair of Integrative and Functional Nutrition at Saybrook. I think I recognize most of the names on the call today, so I'm very pleased about that. And what I'm going to do is I'm going to go through the presentation, and we will save time for questions and answers at the end and have a discussion of this topic or whatever you'd like. This is being recorded, so with no further ado, I'm actually going to take my webcam down so that we can save bandwidth. Oops. So what I plan to present today to you is an overview of what irritable bowel syndrome is. I'd like to explain what FODMAPs are. You may have heard of them, you may not, you may be very familiar with them, you may not. I'd like to then introduce the idea of a FODMAP restriction diet and how that relates to potentially reducing and helping people with irritable bowel syndrome. I will, at the end, discuss the importance and role of the nutritionist and dietitian in helping patients use the FODMAP restricted diet, and then offer some additional resources and finish up with answering questions. The learning objectives are that at the end of this presentation, I'd like for you to be able to explain what FODMAPs are and maybe identify where some are found. I don't expect you to have a memorized list of high and low FODMAP foods because, as you'll see, that's nearly impossible. Explain how FODMAPs can contribute to symptoms of irritable bowel syndrome. Describe the process of a FODMAP elimination diet. And then explain some of the challenges and potential concerns with a FODMAP restricted diet. So just a little bit about irritable bowel syndrome. It's classified as a chronic functional gastrointestinal disorder. It's very high prevalence. Estimated globally is 9 to 23%. We have been noticing a rise, likely due to a combination of the incidence as well as people noticing it and reporting it. And it's the #1 condition seen by gastroenterologists in the United States. Functional GI disorders are just that. They are disorders of the gastrointestinal tract that then exhibit themselves in functional impairments. So constipation, diarrhea, pain, bloating, urgency. However, upon testing, there's no observable biochemical or structural abnormalities. So a colonoscopy is not going to identify ulcerative colitis, or celiac disease is not going to be identified. The proposed pathophysiology of irritable bowel syndrome, it's really not understood exactly what irritable bowel syndrome is, how we develop irritable bowel syndrome, but there are some proposed pathophysiologies. There's some genetic associations, although we don't have genes necessarily to identify them, irritable bowel syndrome yet. Altered motility, visceral hypersensitivity, classification as a gut-brain disorder. It might be dysbiosis, so impairment or alteration in gut microflora, small bacterial overgrowth or bacterial residing in areas where they typically don't. Food sensitivities, carbohydrate malabsorption, or a chronic low-grade inflammation that we don't pick up yet on biochemical or other tests. IBS is somewhat of a frustrating diagnosis for people. It's really diagnosed based on ruling out other conditions. It's diagnosed based primarily on symptoms, so altered bowel habits, chronic constipation, diarrhea, a mixture of the two, pain, bloating, urgency, and ruling out of conditions such as a C. difficile infection, celiac disease, inflammatory bowel disorders. And lab work is usually checked with the majority coming back normal. There may be some alterations in lab work due to, as a secondary of malabsorption due to repeated diarrhea. So there might be low iron. But primarily IBS is diagnosed on ruling out other conditions. The treatment of IBS really varies, and it involves a lot of trial and error. So lifestyle. We know that chronic stress can contribute to irritable bowel syndrome. So making sure that adequate sleep, exercise, and stress management is part of the lifestyle. There are some medications available to help suppress or address symptoms, maybe antispasmodics, antidiarrheals, laxatives, anti-anxieties, and antidepressants. Probiotics and antibiotics are used and in some cases helpful for addressing irritable bowel syndrome in people. Psychological therapy, so working with cognitive behavioral therapy, hypnosis, relaxation training, again, that mind-body, gut-brain connection. Complementary alternative medicine, yoga, meditation, mindfulness, acupuncture, all of these can help address the symptoms and improve the quality of life for people with irritable bowel syndrome. And of course, diet. So thinking of diet and irritable bowel syndrome, there was a very recently published article which surveyed U.S. gastroenterologists. Over 1,500 U.S. gastroenterologists responded to the survey. And what they reported was that most people with IBS do associate their symptoms with food. However, they're not quite sure what food or triggers their symptoms. It's just that eating, sometimes they can identify those, but it's not always consistent. Most patients do trial and errors of different diets. So maybe a gluten-free diet, lactose-reduced diet, removing coffee or other things that they've heard are associated with irritable bowel syndrome or they themselves might be noticing. However, it's rarely to a complete cure for them. Over 70% of gastroenterologists actually commonly recommend dietary interventions. So they recommend interventions such as primarily the low FODMAP diet, high fiber, lactose reduced. Gastroenterologists actually consider that diet is effective. Some of them consider it as effective as medications or other treatments, with low FODMAP diets being considered highly effective for many people and the most commonly recommended through gastroenterologists. So I've mentioned FODMAPs, but I haven't explained what they are. So FODMAP is an acronym: fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols. So oligosaccharides are not quite complex carbohydrates that are not well digested and absorbed in the gastrointestinal tract. Disaccharide, being lactose, is for some people not digested and therefore continues and doesn't get absorbed in the gastrointestinal tract. Monosaccharides, this being fructose, and I'll explain the caveats of fructose in a little bit, but for some people there's an intolerance to fructose, and so it doesn't get absorbed and again continues down the gastrointestinal tract. And polyols, so these are your sugar alcohols, sorbitol, xylitol. We think of these in sugar-free foods such as sugar-free gum or some sugar-free or ice creams or those types of foods, as well as sorbitol is naturally found in many foods, cherries, apples, peaches, etc. So they are also poorly absorbed. All of these being poorly absorbed then travel through the gastrointestinal tract, reach the colon where they're fermented. So fermentable carbohydrates means that they are eaten and chewed up by the bacterial in your gastrointestinal tract. And that's actually a health promoting thing. The bacteria eat these carbohydrates. It actually feeds the bacteria so that good bacteria can survive. It bulks stool and reduces constipation. It can actually lowers the pH, so it increases calcium absorption. It strengthens the GI barrier. So you may have heard of gut permeability. Well, fermentable carbohydrates and some of these fatty acids that are let off through the fermentation process can lead to strengthening of the gastrointestinal barrier and reduce risk of colorectal cancer, which is a big deal. So FODMAPs are not bad. It's just that they do come with side effects. So fermentation, the result is gas production, flatulence, bloating, abdominal pain and watery stools and diarrhea. People with IBS have increased susceptibility of these side effects, or the side effects are more pronounced, either in the terms of they are more produced, or the pain aspect or the bloating aspect is more bothersome to people with irritable bowel syndrome. So the FODMAPs are fermented, as well as they can fermented causing gas, bloating, pain. They can also increase osmotic load. So I'll explain that in just a minute, but when fructose or lactose or sugar alcohols are not digested and absorbed into the blood system, they remain in the intestine. They actually pull water into the intestine. That's the osmotic load. So here you have fructose, for an example. This could also be a sugar alcohol or undigested lactose traveling through the small intestine to the colon. It should be absorbed in the small intestine, and for many people it is. However, for people with fructose intolerance and many people with irritable bowel syndrome, fructose is poorly absorbed in the small intestine. That fructose then remains. It attracts water like a sponge, pulling it into the small intestine. Water dumps into the small intestine, moves things into the colon faster, where the fructose is eaten up. You get flatulence, abdominal pain, and diarrhea. The oddity with fructose is it's not all foods with fructose that are a problem. It is the fructose to glucose ratio, so it's called free fructose. I'll go in a little bit more detail with this later, but so fructose and glucose are naturally found together in sucrose in equal amounts. Sucrose is generally not a problem for people with irritable bowel syndrome. However, once that fructose ratio actually starts increasing relative to the glucose, we get symptoms. So agave syrup is very high in fructose relative to glucose. That's oftentimes a problem for someone with irritable bowel syndrome because of fructose intolerance. Honey is another example. Many fruits are examples of this, and fruit juice. So does reducing or removing or eliminating FODMAPs from the diet help? Well, there's actually been a number of studies. And so what I will show you is a meta-analysis. Schumann et al. Recently this year published this meta-analysis where they looked at 9 randomized controlled trials for a total of 596 people with irritable bowel syndrome. These trials all compared a low FODMAP diet with different diets, be it the habitual diet, Western, a sham diet, or other irritable bowel syndrome diets, maybe a low-fat diet. They address symptoms, quality of life, and safety of the diet. The results show with, as you can see here, these are the individual studies listed. The red dots are the mean results, whether they favor the low FODMAP diet, whether people had a reduction in symptoms favoring the low FODMAP diet, or if the people had a reduction in symptoms, in the gastrointestinal symptoms, favoring the control diet, whatever that was for that individual study. As you can see, for the majority of the studies, they fall on this side, and when summed up, there is a quite significant improvement in gastrointestinal symptoms in people who followed the FODMAP, low FODMAP diet as compared to the control diet of that study. They also found that not quite as strong, but that the consuming a low FODMAP diet for people with irritable bowel syndrome improved health-related quality of life. So self-reported health-related quality of life for people using a validated questionnaire. Not all of the studies measured quality of life, but those that did overall show a favoring of health-related quality of life for irritable bowel syndrome patients when consuming a low FODMAP diet relative to a control. And you could probably understand why. You have a reduction in symptoms, diarrhea, pain, urgency, and that itself is going to, you imagine, lend to an improvement in just general feelings of well-being and quality of life. So this meta-analysis, which was a summary of many studies, showed that low FODMAP diet significantly improves GI symptoms, abdominal pain, and quality of life for patients with irritable bowel syndrome. It's consistent with other meta-analysis and reviews showing that a large majority of people with irritable bowel syndrome do have at least some improvement in symptoms when FODMAPs are restricted. And that the low FODMAP diet does seem to be better than other standardized irritable bowel syndrome diet approaches. So how do we do a FODMAP restriction diet? It's actually considered an elimination diet. And an elimination diet, you want to remove all of the proposed offending components, the possible offending components, for a period of time. Here it's about 4 to 6 weeks. Then you want to challenge. You want to see, okay, what's bothersome, what's not. So there's a reintroduction phase. And then finally, you have a personalization phase for long-term maintenance. So for example, a client who has irritable bowel syndrome and is prescribed a low FODMAP diet, you would walk through or customize with them using a list of high and low FODMAP foods, removing as many high FODMAP foods and replacing them with low FODMAP foods. These are just examples of foods in different categories. FODMAPs being oftentimes, they're carbohydrate, so it's going to be your carbohydrate containing foods, grains, vegetables, fruits, dairy. I like to actually keep the person's diet as similar to their usual eating habits as possible. They're already making these changes in food, the actual food. I'd like to maintain as much habitual quantity or processing as I can to eliminate any confounding variables. So for an example, 1% milk is high FODMAP. For that person, I would switch them to a lactose-free milk, as opposed to just removing the dairy or the liquid component altogether. Agave, switch to sugar. Maybe trade out an apple for a banana or an orange. Whole wheat bread at lunch, switch to gluten-free bread. Gluten is not a FODMAP. However, gluten is found in wheat, rye, and barley, and those have high amounts of oligosaccharides, so they are FODMAPs. However, it's important to read the label on gluten-free bread to make sure that other ingredients are not in there that are high FODMAP. Maybe trade pasta for rice, cashews for walnuts, cauliflower for zucchini. But I like to try and keep their, if they have soup every day for lunch, I would like them to continue having soup to maintain the comfort, their habitual diet, but just change out the ingredients of that soup. You want to Follow the diet for about 4 to 6 weeks and have a symptom diary kept during that time. If no improvements are found, then FODMAPs are not likely the contributing factor. So there's no point in them continuing a low FODMAP diet. Remove the restrictions and move on to some other lifestyle diet approach to helping this client. However, if they have noticed improvements, there's a few things. They may notice improvements very quickly, but it's important that they stay on low FODMAP, basically elimination of all FODMAPs for 4 to 6 weeks. This will allow for gastrointestinal healing. While I said that there's no observable abnormalities in the gastrointestinal tract, there may be increased permeability, there may be low-grade inflammation that the FODMAPs exacerbate. So by removing them and keeping them out of the diet for 4 to 6 weeks, you're allowing the gastrointestinal tract to heal. After 4 to 6 weeks, you want to move into the reintroduction phase. So they've noticed improvements without the FODMAPs. Now we want to actually see, okay, which FODMAPs are problematic in what amounts. So the reintroduction challenge phase is cumbersome. It requires that a person consume you do it systematically, where they introduce one high-fat FODMAP food from an example category. So maybe it is the polyols. You wouldn't want to choose apples because apples actually fall into multi-categories, polyols, as well as oligosaccharides, I believe. I'm forgetting right now. But rather you would want to choose one food that represents that category, a single category. Reintroduce it in certain quantities for 3 days and note symptoms during that time. Following that, resume the low FODMAP diet for 3 days, again to just settle everything down. Then move on to the next category. You do this throughout all of the categories and you review the symptoms with the individual. The next is actually to start testing combinations, portions. So if a person was able to tolerate avocado in a half of an avocado, maybe we want to increase the avocado or see if it pairs well with another high FODMAP food to get them back to challenge and reintroduce some of their more habitual eating habits and see what works. Ultimately, once you've collected enough information, you want to personalize the diet for the person. So it's meeting with that person, seeing what works, personalize it, recommending portions, what foods to be aware of, and making it something that they can sustain longer term. Now, this doesn't mean this is a one and done. You actually should reintroduce some FODMAPs over time. It may be that it's that there is some tolerance that comes with the change in microflora over time. So other FODMAPs might become tolerated later. There might be reduction in stress at a later time. So again, some more high FODMAP foods might become more tolerated. So as that person becomes ready and more relaxed, introduction of more high-fat foods and experimenting is warranted. So the question you hear, or you will likely hear, is, well, I feel so much better on low FODMAP and the elimination phase. Why do I want to re-challenge? Why not just stick with this? Well, as I mentioned earlier, FODMAPs are actually good for your gastrointestinal tract and your systemic health. They are prebiotic, and that influences your microflora, which, as we're learning, influences your whole systemic health. You also don't want to be overly restrictive with food intake long term. Pulling out the number of foods and in categories of FODMAPs without reintroducing things really leads to a lack of variety in the diet, which can contribute to nutritional deficiencies, reduced quality of life, orthorexia, and other problems. So you do want to do the re-challenge and be able to customize it for that individual. Now I'll go into a little bit more detail on the FODMAP restriction, looking at some of the complexities. So I showed this earlier, showing that gastroenterologists in the United States believe that low FODMAP diet is somewhat effective or very effective for a significant number of people with IBS. In fact, over 75% often recommend a dietary intervention, with low FODMAP being the most commonly recommended. However, I say only, some people think that's a lot. Only 21% of gastroenterologists usually or almost always refer an IBS patient to a dietitian or a nutritionist. Only 30% of that 21% recommend a specialized GI dietitian. They usually rely on patient handouts or other kind of their own knowledge, or a little less detailed, personalized information and material to guide a patient. Why is this an issue? Well, to say the least, FODMAP restriction is not intuitive. You can look at this picture here, and my guess is at least half of those in attendance don't know which foods in that image are considered high versus low FODMAP. And that's understandable. What I showed you here as an example of high FODMAP and low FODMAP foods is just a mere glimpse. We can actually look deeper into foods based on their category, quantify and categorize them as low, moderate, and high FODMAP foods. Here we just have a listing of vegetables. Then we have fruits, meats and meat alternatives. Do you see where I'm going? Look at the complexities. And we've got portion sizes. So it's not high FODMAP if puffed rice is in a half cup. But maybe eventually at a cup or a cup and a half, it actually does contribute too much FODMAPs for a person. Sweeteners, beverages. To say the least, it's a long list. Oops. I mentioned free fructose. Again, we can look up, we can go to the USDA food nutrient database and look up the amount of fructose in a food. However, or glucose or sucrose, but it requires calculation of fructose to glucose ratio in order to determine the free fructose. So it's generally not written somewhere, again, not intuitive, of what the ratio is. So something with a high amount of fructose and glucose may not be a problem. There is a threshold above which, even with glucose, it'll probably be problematic. But it's not information that's readily available, this free fructose. Also, this is not a full image here that I'm showing. Looking up tables and such will often give information based on 100 grams of food. Well, the United States, we don't use grams, and we don't easily convert grams of food to portion sizes. So 100 grams of cantaloupe is probably not much, but 100 grams of banana, a lighter fruit food, might be plenty. FODMAP stacking. This is where a person knows that such and such a FODMAP food is not problematic. However, when you start adding that FODMAP food, consuming it with another high FODMAP food, or that's not problematic, all within a relatively short period of time, that's FODMAP stacking. Adding one on top of the other increases you beyond what your threshold is for tolerance and increases the chances of symptoms occurring. Back to the not intuitive, very unsuspecting sources of FODMAPs. So we might think of vegetables and fruits as being, okay, I get it. But tea, these have chicory root extract, inulin. Some of the health beverages out there might have excess fructose or erythritol or sorbitol. So it really takes a sleuth to look at the ingredients. And if someone's on a low FODMAP diet or a FODMAP restricted diet or doing well on their diet and suddenly introduce something new, start having symptoms and can't figure it out, look at the labels. Look at the labels with that person. Really hone in. If someone just says that they had tea, for example, you want to dig a little deeper. Gluten-free is usually considered low FODMAP because it removes the wheat, rye, and barley. However, other ingredients added in, high fructose corn syrup, sorbitol, inulin, all of these can increase the FODMAP content. So simply looking at gluten-free is not enough. Oftentimes protein bars, snack bars, health bars, we might have sugar alcohols to make them low carb. We may have inulin to increase the sweetening as well as some of the health benefits, but they're problematic for people with FODMAP issues. And of course, different shakes out there. Read the labels of shakes. Many now have prebiotic fibers added. So prebiotic fibers are healthy. However, for people with irritable bowel syndrome, they're commonly a problem. And nearly anything made with onions, garlic, shallots is a problem for many people with irritable bowel syndrome. Onions, garlic, and shallots have oligosaccharides that are in fairly high concentrations and really problematic for people. And they're ubiquitous in our food supply. So pick up a jar of tomato sauce and you generally have some onions and garlic in there. Go out to eat at a restaurant, onions and garlic, even in very small amounts. It's because these are water soluble, the way to get around this and still help people get that flavor of onion and garlic that they really like is to start with cooking the onion and garlic in oil. You'll remove the oil soluble flavoring compounds, but it won't withdraw the prebiotic fibers, which are a problem, and then remove the just use the oil. So oil infused with these is not going to be a problem, but using them otherwise whole or in any kind of water soluble format like a soup is going to be problematic for people. Some of the other challenges of the diet is that other foods, not just low FODMAP foods, can cause symptoms. I mean, broccoli, Brussels sprouts, broccoli is not considered high FODMAP, but I know a lot of people that have problems, excessive gas, pain when consuming broccoli. Some people have intolerances to certain proteins, casein, whey, eggs. So it can be challenging because just because FODMAPs are eliminated does not mean that all problematic foods are removed. There's also a lot of conflicting data out there. You may look at one website and see something listed as low FODMAP, whereas on another website it's listed as high FODMAP. There's a lot of inconsistencies in how we measure FODMAPs. There's no real standardized measurement consistent in different labs. Oftentimes it's quantified by 100 grams versus per serving. So 100 grams of garlic and onion is humongous versus 100 grams of an apple is not humongous. Incomplete data. As I said, we lack standardized techniques for analysis and analysis is not required. So the information is not readily available for many existing foods and most new foods. And then food ingredients change. Manufacturers change ingredients all the time, and foods produced in different countries have different ingredients, or different components, either naturally or due to additives being different. All of this for a patient with irritable bowel syndrome trying to figure out low FODMAP diet or FODMAP elimination and diet to help address their symptoms clearly can lead to anxiety. And that then in and of itself can exacerbate symptoms. So there are a few. It's becoming more known that low FODMAP is a potential benefit for people with irritable bowel syndrome. And in the United States, it's starting to creep in. There is a one brand that I'm aware of, FODI Foods, which this is just a snapshot of what's available there, which produce and sell low FODMAP ingredients. Personally, I find them way overpriced and not necessarily all that beneficial. Olive oil without any flavoring is not a high FODMAP food. So here the olive oil is just olive oil infused with garlic. So it's, again, this is what's available in the United States right now. You can purchase them in different stores and online. Monash University out of Australia is the most well-known and really the groundbreakers in the area of food content of FODMAPs. And they have a lot of useful resources for education, education of health professionals. I do recommend, if you're interested in this, to look at their website. They also have an interesting an app. I haven't downloaded the app. They've got books as well. The app can help people really choose their food in the moment. They don't have to always pre-plan and know what they're going to get well in advance, or stick to an overly limited food group. So the app is active. The problem is the app is based on Australian foods. And they're not all the same. As you know, there are a lot of uncommon foods, a lot of different foods than what we're used to in the United States. So there's some challenges there. There's also a FODMAP certification program. Again, this is out of Australia. I'm not familiar with it being US foods being certified, although it does say that it's international certification. So if you see this symbol on a food, it means it's low FODMAP or FODMAP friendly, and they've tested it and achieved the certification to be classified as low FODMAP. So in Australia, there are a few more resources for identifying and shopping for low FODMAP foods. So just to summarize the low FODMAP diet, what we do know is that the low FODMAP diet or FODMAP restriction reduces irritable bowel syndromes in about 2/3 of patients. Some studies are higher, some are just about that. It takes about 4 weeks of this restriction phase. The reintroduction and education is very time intensive. It requires a lot of knowledge, a lot of sleuthing, and really I don't see that gastroenterologists or et cetera are that well versed in this and prepared to work personalize with their patients. To date, which is an interesting concept for a research study in the future, is that there's no studies on patient-instructed implementation of low FODMAP diet. So where you provide the information and the education and then see how well a person can follow that education on their own. So we know about 2/3 of patients can benefit from a low FODMAP diet when that FODMAP diet is very well defined and followed and laid out for a person. How well people can follow this diet on their own is not as clear. And as I showed you, there's obviously some complexities to following the diet. Some concerns with the low FODMAP diet. Again, it is a restrictive diet, so it's important to look out for nutritional deficiencies. Calcium and iron tend to be the ones that greatest, most frequent deficiencies or shortages in a low FODMAP diet. Vitamin C, folate, and fiber, all also at risk of deficiencies. And when you think about the food sources that dairy, vegetables, fruit, you can understand why these nutritional deficiencies are present. Changes in the microflora. So you're limiting the number of prebiotics, the growth medium for that healthy bacteria in the gut. We don't know how that's going to affect systemic health or localized health in the gastrointestinal tract. So really that's just a question that remains unanswered. And therefore we want to limit the restrictions as much as possible and work with someone to personalize the diet and loosen up the restrictions. It can lead to eating disorders, orthorexia, where individuals are overly consumed with a quote unquote healthy diet to the point that it really interferes with life. And then there's extra caution really warranted for people on other sorts of restricted diets. So a vegan who now is being challenged to remove FODMAPs from many grains, many legumes, you can see where it can be a challenge. Diabetics who are, this adds another level of complexity to following a diabetic diet, and the list could go on. So what can a nutritionist, dietitian do? The first thing is really learn more. As I mentioned, the gastroenterologist, 21% are referring to nutritionists and dietitians. However, a very small number are referring patients to an expert in this area, a nutritionist or dietitian that really knows their stuff when it comes to FODMAPs or irritable bowel syndrome or gastrointestinal health. And I think that gastrointestinal health and looking at some of these elimination diets really does take some specialization. You have to know food, you have to be interested, and you have to be willing to work with people to customize their diet. So places to learn more, Monash University, Monash FODMAP.com has some great resources. Keep up with research. Research is coming out. There's a lot coming out. The 2018, there was a lot coming out. And what we're seeing is more research on FODMAP content of different foods in the United States. So they're measuring more foods, producing more lists, and that'll be helpful. Advocate for those patient referrals. Partner up with GI docs. And really help personalize diets for people to help them get relief. Don't over-restrict the diet though. Remember the importance of reintroducing foods and customizing that diet so the person can live as normal of an eating routine life as possible. Keep up with the food marketplace. You would be surprised how fast some foods change ingredients just from simply adding a prebiotic fiber in place of something else can happen, and it doesn't need to be called out on the label. So keep up with the food marketplace. Also keep up because who knows, there may be more introduction of low FODMAP certified foods. Understand FODMAP restriction, it's not a cure for IBS. We don't know what's necessarily causing IBS. It's a dietary approach. It works best when it's done in combination with other practices. So mind-body practices, stress relief. It's not going to work for everyone. There are plenty of people with IBS that FODMAPs are not the trigger of their symptoms. And then I mentioned other foods that can cause symptoms. So understand FODMAPs restriction is not a cure. FODMAPs are not an evil. They're actually a good thing. It's how individuals respond to them. And now, I'm ready to answer some questions.
I have a question about alternative dairy or alternatives to dairy.
Yes.
So you had said it's from 1% milk to, what was the transfer, the acceptable equivalent?
So I said Lactaid milk. That's actually a brand name of a lactose-reduced milk.
What are your thoughts on all the coconut milk, the hemp milk, all the nut milks, cashew, almond?
So commercial almond milk is not a problem. So that would be low FODMAP. Coconut milk, it depends on what you're talking. If you're talking about the canned coconut milk, is actually usually considered high FODMAP. Cashew milk, because cashews are high FODMAP, that would probably be high FODMAP.
Okay.
Almond milk produced at home, as opposed to commercially, is likely to be higher FODMAP.
Okay.
So yeah, it's really a challenge. But yeah, so I have no problems with using those as well. The one thing, just be aware of the nutritional components. So the B12, the calcium, the vitamin D. You want to make sure that if dairy is heavy in someone's diet and you're removing it, that you're putting back those sources, and not all milk replacers have them.
What about the alternative milks like goat cheese or sheep's milk? How do they factor
So softer cheeses are generally high FODMAP.
in? Okay.
Hard cheeses are not. So it's the lactose content. So cheddar cheese actually has very little lactose and very low carbohydrate.
Mhm.
So the lactose has been removed. It's not considered high FODMAP. That said, I know the fat content of many cheeses can be a problem for people. Yeah, but cottage
Basic
cheese
a-
would be a problem.
aged cheeses are okay. Anything?
Um, that I actually I think it always depends on the cheese, but sometimes with, for example, blue cheese, there's prebiotic fibers, there's
Mhm.
the bacteria in that are not FODMAP, but they can contribute a lot of symptoms to people.
Okay.
So
I
people with irritable bowel syndrome are more susceptible to just symptoms from uh, probiotics.
right. What would integrating a multivitamin do to make up for the loss in certain nutrients that you lose when following a FODMAP, a low FODMAP
Yeah.
diet?
I personally, I think it's a good safety caution thing to
Mhm.
do. I would recommend a multivitamin along with pretty much any restrictive diet.
Mhm.
You want to look at the multivitamin to make sure that it's getting what you want. And gummies, for example, oftentimes they're very high sorbitol,
Mhm.
FODMAP. So you want to make sure you're looking for what you need. But also recognize that there's a lot more in foods that we're taking out than just those nutrients, so the phytonutrients, and you well know this.
Mhm.
So that's another reason we want to liberalize the diet. But because of the micronutrients, I would recommend a multivitamin,
Mhm.
recognizing that calcium is a big a big mineral not usually found in multivitamins. In
Can't you get it in other foods though?
Oh, absolutely. But
Spinach, greens, and stuff like that. They all have calcium.
yes, kale is a well-absorbed form of calcium. Calcium is not as well absorbed from many plant foods as it
Okay.
is from dairy. And I promise I do not work for the dairy board. Um, so you want to spread calcium throughout the day. But if you're using non-dairy sources of calcium, you really need to pay attention to making sure you get plenty of variety of sources, because they're not as well absorbed, they're not as concentrated.
Okay. Thank you.
Sure, excellent questions. Other
I had
questions?
a
Hi,
question just
Mary.
to piggyback off. Hi, how are you? I just had a few questions, but I wanted to piggyback off of the almond milk one. I was curious what the process would be that makes it different from the commercial grade and the homemade.
Um, Good question. My guess is that commercial almond milk contains very little almond. Um,
Oh.
so the almond's not really there. It's almonds, I think in about 15 almonds, or maybe it's 7 almonds, is where the FODMAP becomes high. And so if you're making it at home, you're going to extract more of those poorly digested carbohydrates found in the almonds, same with cashews. Whereas if you get the commercial, very little almond is actually in there. I don't know why. I don't know what their extraction method is that's different, but they don't
Right.
use that many albans to make it.
Okay, that's interesting. I'll have to look that up to see what that content is.
Yeah, yeah.
Good.
There is some work on it out there, more in the social media than anything, just about how the difference is. But yeah.
Okay, and then is that another question for the keeping up with the food marketplace?
Mm.
How would you go about doing that?
Um, that's a good question. See, I have a love for doing that. I just find some of the new products on the market really interesting and odd and funny and crazy. So I subscribe to things like Food Navigator, Nutrition Navigator. There's Supermarket Guru. There's Hungry Girl. They, I don't subscribe to them to follow their diet approaches, but to see what's new and coming out. So Nutrition Navigator, Food Navigator, they're actually really about the up and coming food trends in the market, new products, generally with a healthier bend. And so that's where you usually find foods with sneaky little add-ins of inulin or chicory root fiber, or those healthy ones because, hey, prebiotic, adding fiber. And then those same sites would probably announce if there's a new low FODMAP certification program.
Okay.
So it's just as you get more, if you're interested in it, just keep your eyes open.
Okay.
There's also a natural foods expo every year on
Yep.
each coast that I've gone to for probably 16 years running, and
Yep.
it's
Oh,
the
really?
industry. It's the place to go in the alternative food market industry. And almost all of the people that attend the show are new companies coming out with new products that are supposed to be or designed to be more natural and more organic and more environmentally respectful and conscientious. And it's a really fascinating show if you have the time to go. And the meetings, it's 4 days. It's in LA and it's in Baltimore, or I think Baltimore or DC.
Okay.
And it's absolutely fascinating. It's so overwhelming. But a lot of the brands that you see in Whole Foods and Sprouts, a little bit in Trader Joe's, they're all present there, plus a million more. So it's a really big eye opener to see what's going on in this industry as far as food is concerned.
Yeah, that one I have not been to. There's also Institute of Food Technology in which I haven't been to either, but I would really want to go to the Natural Expo. And then if you're interested in supplements, which also cross this line, there's Supply Side East and Supply Side West, which Supply Side West is going on next week. So again, they're largely about marketing new products, introducing new products, ingredient manufacturers, as well as product manufacturers. If it's your area of interest, being aware of what's out there is most important. Not that you have to advocate for one or another, but just being aware of, wow, what are people facing? Why is this so challenging? Because they've got 2 food shows on a year just dealing with new products of natural foods. It's amazing.
They also have biopharmaceuticals and supplements as well at the expo.
Yeah. Yep.
It's just huge. It's so cool.
Yeah.
Hey, Jeannemarie, I have a question.
Yes.
Two actually. This is Kirsten, the
Hi,
other
Kirsten.
Yep. So I'm just curious, like, when people find that they do have a sensitivity in the FODMAPs, do they find that it's like to one of the categories that you kind of broke apart, or is it like a specific food in like the different categories?
That's a good question. And it's usually to a category and the foods found in that category. It's usually more than one category. And within a category, you can have more and less tolerance to certain foods.
Okay.
So you may not be able to tolerate cauliflower at all, but you can have a few mushrooms and be okay. And they're both fall in the same category. So yeah, and then
Yeah.
foods that are low FODMAP, you eat them in large enough quantities, they become high FODMAP. So it is usually category. If someone is not fructose intolerant, they're generally the category of fructose is not going to be a problem unless that food also has other FODMAPs in it, or they really surpass the normal amount for absorption.
Right. So it's not necessarily like a food sensitivity issue, or, I mean, I guess like,
Right.
so my other question, I'm just curious about like, and I just heard about this and I don't know too much about it, but like where you can have like a bioscan done to see like your sensitivity to certain foods, and like if that would show up in regards to the FODMAP, because like if you like, yeah, you eat mushrooms and they make you feel terrible, then like you would think you would have some kind of sensitivity issue, I guess. But
So
maybe I'm thinking about it.
generally the sensitivities are some sort of immunological, biochemical, I mean, those sensitivities. This is a
Yeah.
food sensitivity, but it's more gastrointestinal located. And it's not an IgE, an IgM, an IgA, whatever, reaction. So someone who is sensitive to certain food chemicals, one person I know is sensitive to a food dye, that's a different reaction than this would be. So it's probably, I mean, there's not a test for this yet in people. There are tests for lactose intolerance. There's test for sorbitol intolerance. There's test for fructose intolerance, but there's no blanket test, and even those individual tests are not perfect. The gold standard really right now for identifying FODMAP sensitivity is the FODMAP elimination diet, but you have to do it right.
Yeah. Okay.
Yeah.
Cool. Thanks.
Sure.
I had a question about artificial sweeteners.
Who is
I was
this?
wondering kind of, oh, sorry, it's
That's
Elise.
okay.
Elise Server. Sorry
Hi,
about that.
Elise.
Hi. And I was wondering kind of where stevia fit into it.
Good question. So stevia is not considered high FODMAP, and it's oftentimes one of the recommended ones. However, stevia is oftentimes cut with things like erythritol, which is a sugar alcohol, or other sugar alcohols, and that would then make it, or maltodextrin, which can sometimes be a problem for people. So if it's pure stevia extract or powder, it's generally fine. But if it's cut with something or a mixture, a blend, it's generally not fine. Does that answer that?
So pure stevia. Yes, it does.
Yeah.
Thank you very much.
Sure.
Can I ask you about monk fruit? What have you heard about?
You can, and I don't know that I'm going to be able to answer it well, but I did look it up, and it's considered low FODMAP because I get monk fruit and there's another jackfruit mixed up. They're totally different, but
The substitute for chicken and vegan food.
yes. I think that's high FODMAP, but don't quote me on that. But I believe monk fruit is low FODMAP. It's just a little cost prohibitive for many.
Yeah, it is pretty expensive.
Yeah. One thing I will say is that if you do a search of the internet or Pinterest or a lot of places, you will see websites for FODMAP restriction, low FODMAP diet. There's a lot of good resources out there. However, it's that personalized approach that I really want to emphasize with people. The websites oftentimes remove and restrict every FODMAP. They don't oftentimes give enough information about the reintroduction, and so long-term following these websites and using them as a resource identifies high and low FODMAP foods, but that's not personalized to someone. So that's where there's really, I'd say, room for professionals in this area to work with individuals, to personalize it, to relax the restrictions, because really restricting all those FODMAP foods, as I mentioned, can become challenging, causing anxiety and a number of other things. So I'd say there's a lot of room for working individually with people, as well as maybe teaching classes, cook either in the kitchen or, I mean, irritable bowel syndrome is so pronounced and prevalent that bringing the attention to other healthcare practitioners, to groups, I'd say there's opportunity there as well. Just I'm not seeing those done right now.
Jeannemarie, do you think, like, I mean, clearly I think there's definitely a need for this in the professional market, but like how, like at what point, like is this, like our nutritionist going to be paired with gastroenterologists and like primary care physicians? Like did you see that like curve changing? Like
I do. I do. I just I see good gastroenterologists recognizing that it's not in their bandwidth to cover this. The problem is that it takes a lot of time and dollars for patients to address this with a dietitian. It's not oftentimes covered fully by insurance, so that's another barrier why gastroenterologists are not recommending people to go to dietitians or nutritionists. So it's a barrier. I see gastroenterologists recognizing the need more, but I don't see them necessarily having the resources to get there. So somehow breaking down that wall and getting more patient-friendly access is needed.
okay.
Yeah.
How easy do you think it will be to align yourself with a gastroenterologist? Doctors tend to be, and this is because I grew up with one, very territorial of their
Area.
what they diagnose. So how I see that probably a pretty big challenge is to infiltrating that realm. Like there might be a greater awareness for the doctors and the need for nutritional counseling along with it, but to what end? Like, are they willing? Have you seen?
I think you could sell it. Personally, I think you could sell it to gastroenterologists without much difficulty.
Okay.
I haven't tried myself, but I think many recognize that, they're not into talking about cauliflower and zucchini with people. They don't have the time for that. And if you're able to demonstrate greater success for their clients and their patients, and their patients are writing good reports about them and the success with that doctor, all the better for them. So I see it just takes a matter of you selling yourself and your benefits and why, but, and deferring to them. They are the expert. They're the ones diagnosing. You're matching that diagnosis with dietary lifestyle treatment.
How do you suggest we navigate getting opportunities like that? Just going to see gastroenterologists? First getting yourself just more integrated in the healthcare field. It could be going to visit gastroenterologists. It could be going to professional shows, professional conferences, maybe just on gastrointestinal health. This is a hot topic there. You'll see other nutritionists interested in this area, and you can talk with the health professionals there. You can, just somehow getting yourself introduced to them or introducing yourself to them, reaching out, be it to independent individuals or the community of them in your area, or ask for patient referrals or patient recommendations. Yeah.
And again,
Great.
sell your skills. You, I'm sure others on this call have very unique set of skills that complement this, but you also bring the food and cooking education piece. So that's another level up for you. We may have health coaches. We may have others who can practice mind-body skills as well as diet therapy. So bring the whole you and not just this one piece.
Okay.
Other questions?
Can I ask your thoughts on the Stephen Gundry plant paradox diet?
I'm not familiar with it, actually.
Okay. I'll email you the link. You can read about
Gundry, I know the name.
Stephen Gundry,
But yeah.
cardiac specialist in Palm Springs,
Yes.
and he's got another one in California, another office somewhere.
Yeah, I was looking at that recently. Why was I looking at that recently? I forget why I was looking at his websites recently.
He talks a lot about how there are hidden lectins.
Oh, he's the lectin guy.
Yeah.
I forgot about that. I have not seen, lectins are in a lot of foods. There's actually some potential benefit of lectins. I haven't seen the real data showing that they're a problem. I haven't really looked though too extensively. And so there's the potential health benefits. There may be people intolerant to them at higher amounts in particular. I think you can reduce some of them through cooking and processing.
Yeah, there's a way to do it. It's
Yeah.
soaking. It's a lot of soaking foods.
Yes.
Cook them.
Which we all just have tons of time to do.
Oh, indeed.
Yeah. And when you hear about FODMAPs and the FODMAP diet, my hope is that it doesn't become a fad diet and being used for weight loss and other things like a gluten-free diet. It's a very restrictive diet and it has its purpose. But it's helpful for a lot of people, but it's not going to help with weight loss or anything else except for the fact that you're overly restricting, maybe. Okay, other questions? Well, I really appreciate you all showing up. I know Sunday is not the easiest, but it does work well for some. So thank you. And I will have this recording available soon. I'll post it in the Mentoring Center. And if any of you have questions about this or other nutritional things, program things, I'm available. So just send me an email and we can always talk, email, hop on the phone, whatever. Okay?
I wanted to ask you, just finish our conversation if I may, afterwards, if that's okay.
Yes. Yes.
Okay.
Do you want to stay on? I'm going to stop recording.
For a minute, if that's okay.
Sure. Did I stop recording? Oh.